Hey, Dr. Clements, I want to remind you that a lot of the diseases we treat are caused by our lifestyles. And the best part about lifestyle diseases, if your lifestyle brought it to you, your lifestyle can take it away. So a lot of times type 2 diabetes is brought on by lifestyle. There are other things that can bring it on as well, like chronic steroid use or things of that nature. But I'm talking about if you're sedentary, if you're eating a poor nutritional diet, that can bring on type 2 diabetes. A lot of times high blood pressure can also be lifestyle. I think it's 1% that's truly essential hypertension, and that's a genetic thing. But again, we're talking about 1%. That's not a lot of people. So what your take home is, what do you have that you must do to reverse these problems? So it puts the power in your hands. Find out if you can and do it.
Frequently asked questions and myths about foot health. Common issues include plantar fasciitis, bunions, ingrown toenails, and fungal infections. Foot pain is not normal. Early care prevents serious problems. Some nerve damage cannot be cured, but treatment eases symptoms. Lastly, fungal toenails are treatable and new therapies restore healthy nails.
So why is it important to have a really good solid orthotic? Imagine having a tire that has a flimsy support. Every single thing above, or what we call everything that's in the superstructure, will be off balance. Why do we recommend custom-made orthotics? Because you want something that's custom for your arch. All of these orthotics, whether we're talking about a sport, whether we're talking about a dress, there is a solution for everybody. There are solutions for pediatrics or for kids as well. So my job is to help you diagnose the problem, and we want to treat the problem. Most of the time, though, we are treating the symptom instead of the problem. No. At Flat Shoals Foot and Ankle Center, we diagnose and treat the problem so that the symptoms will go away. So come on in to be evaluated for a custom-made orthotic arch support so that we can reestablish your foundation and get you back on your feet again. Hey, Dr. Clements here. So today I want to talk about venous disease. Venous is having to do with the vein. And I want to specifically talk about venous insufficiency ulcers and what can be done to prevent them or to treat them effectively. So the artery brings the blood away from the heart. The arteries bring the blood away from the heart, but the vein brings the blood back to the heart. So in order to go back to the heart, the veins are going uphill, or the blood is going uphill through the veins. The veins have valves. The valves keep the blood going up. Ordinarily, what should happen is the valves should close as the blood shoots up. With venous insufficiency, the valves become incompetent, meaning they don't close properly, so the blood shoots back down. So that's why we start to see those, the varicose veins, they start to dilate, they become wider because there's incompetence. So one of the treatments after this has been properly treated is compression hose, which is great. Walking is excellent as well. You want to treat the problem, not the symptom. So with varicose veins, you can develop venous insufficiency. Basically, the valves are not closing in the veins and the blood is pooling or going back down. Because remember, the blood has to go back up to the heart, so it's an uphill battle, right? So what will happen is as the fluid begins to pool in the legs or the lower extremity, it's going to increase the tension in the tissue, which will cause itching initially, like an itching burning sensation, but then it's going to cause ulcers at the site. And it's usually at the end around the ankle or in the leg is where we tend to see these venous insufficiency ulcers. So those need to be treated because they're very painful. In addition, there has to be proper compression, but we have to treat the wound as well. But in order for those to heal, we have to stop the excessive fluid that's building up. So it can be treated 100%, but we have to understand what's causing the problem, treat the problem, and not just the symptom. Hey, Dr. Clements. Today I want to talk about calluses and corns. on the feet, most people don't realize these are caused by imbalances. And what do I mean by an imbalance? So if the arch is too high or if the arch is too low is pronation, too high is supination, it will cause an imbalance. It'll create like a buckling. When the toes are buckling, you're either going to get a corn on top or a callus underneath the bottom. So corns or calluses represent an imbalance, a biomechanical instability. You must first treat that. Once you treat that, you can also cut or remove. When I say you, we would do it professionally. It's called debridement of the lesion. We would debride it down to bring it back to normal, but you have to balance. If you don't balance, it's like the tires. You got to balance, align, and rotate. And if you don't have a proper shoe with a proper arch support, the problem will keep coming back and it can become painful, which can cause either bursitis or what we call metatarsalgia.
The top 5 heel pain mistakes women make. Mistake 1. Wearing the wrong shoes. Mistake 2. Ignoring the pain. Mistake 3. Relying only on stretching. Mistake 4. Self-diagnosing and Googling. Mistake 5. Delaying professional help.
Hey, Dr. Clements here. So I want to read one of the plaques in my office, and it says 12 things to always remember. The first one is the past cannot be changed. Number 2, opinions don't define your reality. Number 3, everybody's journey is different. Number 4, things always get better with time. Number 5, judgments are confessions of character. Number 6, overthinking will lead to sadness. Number 7, happiness is found within. Number 8, positive thoughts create positive things. Number 9, smiles are contagious. Number 10, kindness is free. Number 11, we only fail if we quit. And number 12, what goes around comes around. Motivate yourself. Don't wait for anybody else to be your source of motivation. Go within. You have that power and authority. Make your day magical. Make your life magical. It's your choice.
Did you know? Each human foot contains 26 bones, 33 joints, more than 100 muscles, tendons, and ligaments, plus an intricate network of blood vessels and nerves.
Hey there, Dr. Clements again with your motivational minute. So I just want to remind you that every single process happening in your body right now is a miracle for somebody else. What do I mean by that? If you can get up and go urinate or pee, that's a miracle for somebody that is suffering with renal damage, right? Or may need dialysis. If you can have a good bowel movement, that's a miracle for some people with chronic constipation. So, pooping is actually a really big deal. So when your body is doing these things, thank it. Thank it. If you can walk and you have 2 feet, that's a miracle for somebody else. So a lot of times we don't see the everyday miracles that are happening in our lives. If you have somebody who loves you, or if you're able to love somebody, that's a miracle. So enjoy the small things because they're really big for others, okay? Hey, Dr. Clements again. So today I want to talk about PAD specifically. So PAD, some of the warning signs are pain in the leg that's brought on by walking, relieved by rest, pain in the leg that's due to very poor circulation. It could be leg or feet, a poorly healing wound in the lower extremity, the ankle, the legs, also the feet, injury to the lower limb or foot involving blood vessels or discoloration of the toes and feet. So these are some of the signs. Now, a lot of times when a patient is having pain, especially arterial pain, which is what we're talking about with PAD, which is peripheral arterial disease, we're talking about lack of oxygen. So if there's something that's decreasing the blood flow, that something could be plaque, it could be a blood clot, whatever the cause is, we've got to treat that root cause. If we don't treat the cause, then the symptoms, which is a pain, leads to gangrene and amputation. Hey, Dr. Clements again. So I want to talk to you today about gout. Gout is a type of arthritis, and it typically will impact the big toe joint of the lower extremity. It can impact any joint because it's a type of arthritis. It can impact the ankle, the knees. Typically in the upper extremity, we're going to see those big golf balls at the elbow. So it can impact the elbows. It can impact any of the joints. I've noticed mostly in this joint, but it could be any of them. So if you're having pain, it's usually excruciating pain that wakes you up in the morning, wakes you up at night, or keeps you from going to sleep. It might be a gouty attack. And again, gout has a liking, or what we call a predilection, for that big toe joint. And when I tell you, this is the only time grown men will come into my office in excruciating pain, crying sometimes, because that pain is intense. And what is happening, there are uric acids that the body is not releasing. So when protein is broken down, one of the end products is uric acid, right? So uric acid is usually, it just goes out through the urine, right? But if it's accumulating, meaning it's not going out, or too much is being broken down, or the end product of the uric acid is lodging in the joint, or the uric acid itself is lodging in the joint, then it's going to cause pain and inflammation. Icy hot is the best way to describe it, because these are the uric acid crystals, and the crystals are actually in the joint, and it creates a huge inflammatory, so the flaming response. So on average, we're going to see red hot swollen, and nothing, the bed sheets will hurt. It's very painful. Most patients will come in on crutches, or they can't put any weight on it. Very successful to treat it. I usually do a trigger point injection of an anesthetic. And I use two types of anesthesia, one that works immediately, one that's a little longer acting. And the purpose of the anesthesia is to wash the uric acid out of the joint. And when I do that, patients walk out, they hop in, literally they limp in, can't put any weight on it, and they will walk out. And it depends on the severity of their gouty flare-up. So sometimes if their pain level is a 10 out of 10, I'm going to put them in a soft cast, and I'm going to put them in a boot. And I will also prescribe anti-gout medication. Sometimes I do an anti-inflammatory as well. And we also recommend changes to the diet for a patient, because diet is part of it. Lifestyle is one of the number one things that will cause gouty flare-ups. And they call gout the rich man disease. And the reason for that is because it's the foods that are really rich. It's red wine, beer, it's steaks, it's shrimp, it's lobster, it's all the good stuff. Dehydration can also bring on gouty attacks as well. And most of the time when I see men, it's usually because they're outside mowing the lawn, they're drinking a beer, and they're dehydrated, they don't even know it. High cholesterol can also be something that can be part of what's going on to bring a patient in with a gouty flare-up. And then the other thing too is that there are several different treatments that can be done. So an acute flare-up is when the pain it just starts out of nowhere, versus chronic gout. So there are different types. So we have to know how to treat it appropriately. So with gout, you're either overproducing uric acid or you're under excreting, meaning you're not getting rid of it. So there are other ways that we can diagnose it as well. Very easy to diagnose, very easy to treat. It can be treated successfully. So don't sit around on gouty flare-ups, because gout can actually knock the kidneys out, leading to dialysis. So it's something that definitely needs to be treated successfully and made a priority, because not only can it impact one joint, gout is also called a migratory arthritis. So it migrates from one joint to the other joint. So patients will come in and their initial pain may be in the left big toe, and then 2 weeks or 2 months later, it may be in the right ankle. So it will migrate from joint to joint. So our job, meaning my job and the patient's job, is to treat the problem, not the symptom, symptom only, but we got to treat the symptom because it's excruciating. So it's important to treat the overall cause so that we can decrease the recurrence of the symptoms. Okay, hopefully that helps. And may you never get a gouty flare up, because it is a wicked pain, but it's one that I love to treat because again, I've been doing this successfully for over 23 years, and it is such a joy when a patient, literally, they just come in, they're just hobbling, hardly can make it, they're miserable, and we will excuse them because most of the time they're just going to be like irritated and just not a pleasant person. But then when the pain level drops from 10 out of 10 to like a 4 or 5, and they get out of that psychotic pain cycle, then they can think again, and it's like you can see the burden lift. So it's actually a pleasure to treat these things. But again, always get a proper diagnosis so you can get a proper treatment. Okay, bye. Ooh-wee, I love treating gout. There is nothing like the satisfaction of a patient limping in and walking out. I tell you, I do this every day. 23 years I've been doing this, and oh my gosh, here comes another one. It's gotta go. So if you have a red hot swollen foot or ankle, it might be a gouty flare-up. If the bed sheets hurt, it might be a gouty flare-up. If the pain moves from joint to joint, it might be a gouty flare-up. So do not sit on this.
Your feet carry you 100,000 miles in a lifetime. Check them daily, wear the right shoes, trim nails safely. Healthy feet, healthy you.
Hey, Dr. Clements here again. So today I'd like to share some rules that are very vital for us as human beings. So the first rule is the golden rule. Everybody knows the golden rule. It says, do unto others as you would have others do unto you, right? Perfect. Do that. However, the platinum rule says, do unto others as they would have done unto them. Well, why is that important? It's important because whatever a person desires or whatever makes them happy, their love language, that's what is valuable. So for instance, if I do unto others as I would have done unto me, if I'm going to give my husband flowers, yeah, that's going to make me feel good, but he'll be okay with it. He'll be like, oh, thank you. But that's not his love language, because, flowers, he's like neither near here or there with that. So give people what they desire, not so much what makes you happy when you give it to them. Listen to that, what I just said. So today I was talking with a patient and I came up with the Clements rule. Well, what's the Clements rule? The platinum again is do unto others as they would have done unto them, right? But the Clements rule is do unto you as you do to others. Now, I want the positive spin of this. It's very important that you stick with the positive end of it, because when you fly in an airplane, they tell you in the event of an emergency, put your own daggone oxygen on first. Why is this important? Because I find that a lot of times we spend so much time trying to help other people that we go down in the process of helping them because we did not secure ourselves first. So this is not saying be selfish, but this is saying be proactive with your own self-care. So the Clements rule says, do unto you first that which you would do unto others. If you want others to be happy, you allow yourself to be happy. If you want to be rich or help others be rich, then you learn how to be rich. If you want to have wonderful, loving, supportive relationships for other people, you learn how to have wonderful, loving, supportive relationships for yourself. So it's important because I find a lot of times we as human beings, we want to help other people. At our core level, most humans tend to be really good people. Now, here's the drawback with that is that when you tend to always want to give, always want to help other people, it's a wonderful thing. And I did that for years, almost to the point where I was so depleted, I was empty. So what I've learned over my years is I have to fill me up first. So I am purposeful, I'm intentional. I take the time to fill my cup first. What do? I put everything that I need, whatever support. I take time for myself. I listen to my body. I teach people how I want them to treat me. Very important, because if not, you slide into a reactionary life. Ain't nobody got time for that. You want to be proactive with your life as much as possible, and you want to be in the driver's seat. So how do you get in the driver's seat of your life? Practice the Clements rule. The Clements rule says I'm gonna fill me up first, then I give out of my overflow. So when I'm done giving at the end of seeing patients for the day, I don't feel depleted. I don't. I feel energized, because I came with 100% intention. I know my skill. As a podiatrist, I've been practicing for over 23 years now. I've been a podiatrist since 2000. I'm at a level of unconscious competence at this point, and I don't say it arrogantly. I say it with glory to God for the excellence that I can bring to the table to be able to diagnose and treat and literally get patients back on their feet every day. So I'm showing up 100%, but in order for me to do that, I also see that I'm a vessel through which God works. And I see myself as God's hands and feet extended. So when I'm doing whatever I'm doing, I literally am plugged into my source, and I'm calling that source God. Whatever you call that source, right? You got to plug in. So sometimes it takes us practicing being unplugged from social media, being unplugged from the noise of the world, being unplugged and plugging into whatever you define as your source. So take this as your rule, put it in your toolbox, so to speak, and be proactive with it. You can have a flat tire, but if you have a spare tire ready to go, that flat doesn't have to keep you on the side of the road. Have this as a piece of your peace of mind. When you fill yourself up to overflow, whatever you're doing, make sure you have your proper intention set for the day. Make sure you are a person of integrity. You speak, your word mean what they mean. All of these things are ways to keep you in a place of overflow and overfill. So I fill me up first, and a lot of times patients will ask, well, how come you always seem bubbly? You always seem to have a way of helping me feel better. When I leave your presence, I always feel good. I feel warm. I feel hopeful. Well, that's not by accident. It's because I'm very intentional that that's what I'm going to do. But I do it because I realize that I have a tremendous gift, and I'm going to use my gift. And my gift is to help people heal from the inside out. So whatever your gift is, be a person of integrity. Make sure you are a person of self-integrity. Fill yourself up first. Don't lie to yourself. Make sure you're speaking. Make sure you're using your words to create life and not death. And make sure your actions, how you think, how you eat, how you move, are all aligned with your belief system. If your belief system is not what it should be, you may need to change that as well. Take care. Bye. Hey, Dr. Clements here. So today I'm going to talk about fractures, and I want to talk about the main fractures that we typically see in our practices, or at least I should say I see in my practice. And normally stress fractures, they happen, but not as frequently. But a stress fracture is happening on a bone that is thinning, or what we call osteoporotic, or it could be osteopenia. And penia is a thinning of the bone, right? So what happens is walking becomes repetitive micro trauma, and that can cause the bone to fracture. So stress fractures, we see a regular fracture. Typically, the bone is normal, so it's not demineralized, but it's caused by trauma. and that can be another source of the fracture as well. And the third one is not often seen, but I see it a lot because I treat a high diabetic population, is a Charcot foot or Charcot fracture. Now, with Charcot, there is what we call a demineralization of the bone as well. So as a result of that, the bone starts to have multiple fractures. And as that happens, depending on where the fractures are, so say if the fractures are here in the midfoot and the arch begins to fall, it's going to start to have a break right here. As a result, the foot is actually going to become inverted, and these patients are actually walking on the middle of the arch. Now, what's the problem with that? The middle of the arch has no fat. It has no fatty absorption as we do like up here under the ball or in the heel. So as a result, these patients tend to ulcerate. So when they have an ulcer, which is a break in the skin, those easily become infected. So Charcot is another one that's caused by, it's not just diabetes, there are other things that can cause it as well, but usually there is some damage to the nerve, which is peripheral neuropathy, that will be at the root cause of Charcot. So that's why we always recommend our diabetic patients know what their A1C is, because the A1C that's elevated, anybody that's 8 or greater is going to have an increased risk of Charcot. If you've been at 14, Charcot is already knocking on your door, but there's still things that can be done to help to stabilize the foot. Sometimes surgery is necessary. But it depends on the stage of Charcot. If it's an acute Charcot, we're not touching that foot with anything. All we're doing is stabilizing. So again, understanding what is going on is vital, but also understanding what can be done and when it needs to be done is also equally vital. One of the things that is pretty standard is that when we're treating fractures, it's typically about 6 to 8 weeks in terms of treatment. So we're stabilizing the area, making sure that the fracture fragments, meaning that the two pieces of bone, that they're not terribly separated. So if the two pieces of bone are greater than 2 millimeters separated, or what we call displaced, then that usually needs surgery to put the two bones back together. And sometimes we'll use pins, screws, plates. It's literally like a hardware, like you're in hardware school. But yeah, we use all those hardwares to hold the bone fragments together. Sometimes treatment is a hard cast. Sometimes it's a splint. Initially, it's a splint because of the amount of swelling that's around the area, but we've got to stabilize it, but we expect more swelling. So initially, after a traumatic fracture, you're going to go in a posterior splint. And then after that, either a hard or soft cast in some type of a boot, but that's going to be about 6 to 8 weeks for healing. Now, if the fracture is in the foot itself, normally, if the fracture is in the long bones called the metatarsals, we may be able to get away with you in a smaller boot for a little shorter period of time, but we'll do x-rays every 2 to 4 weeks to make sure that the bones are healing well. If the fracture is in the toes or the phalanges, so these I can usually get you pain-free in a surgical shoe and keep you stabilized while the bone is healing. So it depends on the level of the fracture, what type of support in terms of surgical shoe or walking boot or no pressure at all. If it's an ankle fracture, definitely most of the time we're going to see it on the lateral aspect of the joint. Sometimes we'll see it medially, sometimes it'll be both. So again, depending on the level of the fracture, the treatment is going to be a little different, but the root cause needs to be evaluated. We also need to look at the patient to see, are they young? Do they have good bone stock? Do they have good blood supply? All of these things are valuable to understand how to properly treat a fracture. So hope this helps. And if you ever have any questions, always reach out. Let us know. Bye.
this and let it do its thing. Anxiety keeps on trying me.
Hey, Dr. Clements. So today I want to give you a brief review of the foot and where most of the problems I'm treating are coming from, right? So the first, one of the biggest ones I treat every day is called plantar fasciitis. So what happens is the Achilles tendon comes down and it inserts into the back of the heel and it sends fibers underneath that become the plantar fascia. And the plantar fascia lays like this, right? So when you're walking and you're actually, the arch is flattening, we tend to see a pull or a tug right there, and you get small tears in the fiber, and that can be the source of your problem. So plantar fasciitis could be the problem. Achilles tendonitis, where the Achilles inserts here. Another one I treat frequently is a neuroma, which is a pinched nerve as it's going between the bones, right here, right here. So if your foot is swollen, or if you're wearing shoes that are too high, because when your shoe is high, you're actually causing the intermetatarsal ligament to pull together, and it's squeezing the nerve, and that can pinch the nerve. That symptom is usually numbness, tingling, burning in the balls right under here, and most patients will usually feel it's like a pebble-like sensation. They feel as if they're walking on a pebble or there's something in there, right? So that's another one. Another one that I frequently treat is a tendonitis. So this is the middle of the arch. So as the arch comes underneath right here, there's a tendon called the posterior tibial tendon. It attaches right here, and its job is to pull the arch back up, but it becomes overworked sometime, and it's like, I'm not doing this anymore. So what we've got to do is you always want to find out what the root cause is and treat that. Another frequent one that I treat is because people are lacing their shoe too tight. And when you're lacing too tight, if you have little bone spurs, you see right here? That's a little bone spur right here. So if you're lacing the shoe tight, and if you're a little swollen, you're actually going to impinge the nerve, and you're going to create a neuritis, which is the inflammation of the nerve. So on the top of the foot is where the highest pain point will be, but the pain will shoot distally, meaning to the toes, or the pain can shoot up as well. Usually there's going to be a little bit of swelling, not a tremendous amount, and some redness. Now, the differential diagnosis in this area is called a ganglion. So a ganglion is ordinarily caused by trauma as well. So something could have fallen on the foot. You could have been doing a lot of walking. Again, walking can become repetitive micro trauma, and it will cause, there's a little protective layer of like a little fiber that's right on top of the joints right here, right? So what happens is that area starts to become weakened and it starts to herniate or out pocket. And when that happens, the ganglion, the fluid from inside starts to push out, and there's usually a tenting, and it looks like a little ball. And it can be very excruciating because the same thing. We have superficial nerves on top right here, and when those superficial nerves are pinched or any type of injury to them, they're going to start to signal pain, and that can cause pain shooting to the toes, or it can cause pain shooting up. So again, tons of stuff that can happen with these little bitty feet. And the funny thing is, look at how big these bodies are. Yes, beautiful, voluptuous, I know. But guess what though? The bigger you are, the more repetitive trauma you're doing to these little bitty feet. So if you're big, you're beautiful, even if you're skinny and beautiful, I don't care. The point I'm making is you need to have the proper shoes. You have to have the proper support, because when you don't, your feet are going to give you signals. And what are the signals? Numbness, tingling, burning, swelling, lack of motion. You may have cramping. All of these are warning signs that we get from our body telling us something is out of order. So yes, if you have feet, you can have problems, but you don't have to. So again, at the first sign, first of all, you want to prevent the problem, but at the first sign of any type of numbness, tingling, burning pain, you need to be in somebody's chair that plays at the problem that you have, okay? Hopefully that helps. Bye.
Red flag reminders. Don't ignore persistent foot pain, it's a warning sign. If a blister doesn't heal, get it checked. Sudden swelling could mean an injury or circulation issue. Discoloration in toes may signal poor blood flow.